early labor is what we're focusing on today. Early labor is that time, especially if it's your first birth, that it's going to be a little bit like, is this it or is this not, for the very, very beginning. So most people, or I should say a lot of people, start off labor where you're kind of in a questioning phase, where you're trying to figure out, are the sensations you're feeling, your body's acting a little bit differently, is this actually early labor? Is this going to lead to labor? Or is this just, things that kind of happen in the third trimester, Braxton Hicks or something else? So during this time, usually we're not having to cope. We're more kind of trying to figure it out. And this is always the time that I recommend rest. Always 100% rest. So if you have the ability to rest during the time of like, I'm not sure, that's what you want to do. But as labor progresses. So labor starts off usually low, and then as it progresses, gets longer, harder, and closer together, the contractions. This is even with an induced labor. So even with induction, it should start off low. Now, it might have a different pace than a non-induced labor, or it usually will have a different pace. But the beginning, the early part is usually a little bit like, I don't really need to deal with this. Maybe I'm feeling things regularly. Maybe I'm not, but I'm not having to. There will come a time where you will realize, like, I need to cope with this. Like, whoo, okay, this is something. And that's when we start with our breath. And what I recommend is using these long, slow breaths, just like we've done each time, really through the hardest part, when you really feel like, okay, labor is getting more intense, it's starting to peak up, and start our breath. And as labor is, let me just back up a little bit. Contractions and the intensity are like a peak, starting low, peaking up, going down. Now, they're not always a bell curve. They're not always the same amount of, same time as ramping up as kind of ramping down. Sometimes we see things ramp up quick and then have a long tail of tightness. So, and actually, I'm going to put down below a YouTube video about what do contractions feel like. So if you're feeling a little bit like, Alice, I don't know what you're talking about, make sure you check out that video. Okay. So contractions have these peaks. Well, a really cool mental hack with labor is to try to ignore as much of the ends, the building up and the building down as possible. I remember I worked with this awesome client that I was asking her, like, well, how long are the contractions lasting? And she said, well, they're only lasting like, 30 seconds or so. And I said, okay. And then, finally, when I joined her as her doula, I timed her contractions and kind of watched her as she started contractions. And from what I could tell is she wasn't timing the full start through the full end. She was just timing the hardest part, the peak, which was kind of a good strategy as far as dealing with it. She was only in labor, for part of that contraction. So pretty cool. And that's what I want to encourage you to do when you're in early labor. Don't be in early labor and don't be in labor until you really have to. What that means is if there's anything going on that you can kind of ignore. Now, sometimes we see second timers who have already experienced labor or third or fourth, and they tend to be better at ignoring it because they know kind of the trajectory of how things are going to feel. So they ignore things easier. And that's normal. And if you are giving birth the second, third, fourth time, I do still recommend ignoring things if they're not intense, but things might pick up faster if you've already given birth before. So don't ignore it. Don't be too good at ignoring, or make sure someone else knows that you're feeling some things, and they can kind of monitor things for you as well. So early labor starts, things start getting more intense. That's when we want to do our breath. And, for the least amount of time, really, I suggest just as much as you need a little bit of coping over that peak. The other thing about starting your breath in early labor, it is a good sort of practice of coping so that when you get to active labor, which we're going to talk about tomorrow, you will sort of have that foundation done, and it's going to be easier to throw in those extra layers because you've already spent early labor, using the breath as your, main or possibly only technique, and then adding more techniques in active labor. So early labor, great time to start. Only use it when you feel like you really need it. Sometimes I have students that ask, like, when do I start using my breath? Should I do it right now? And it's like, only when you're needing some coping. So that's really that's the main takeaway I want you to think of with breath and early labor, is that don't bring it out until you feel like you need something. Until then, go about daily life. Rest, 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 is what I always say. I'm going to take a quick sip, get comfortable, and we're going to do our practice, because we practice every day, because remember, we're building up that muscle memory of using our breath. And of course, we don't have contractions now, so it's not exactly the way it's going to feel, but that's okay. That practice, from what I've seen working with so many families, is that just doing that daily practice, that you really get that into your brain. You've laid that foundation in your brain so that you don't feel that contraction and feel panicky, feel like you don't have any skills, feel like you don't have anything to do. That's not going to happen if you're practicing like this, for sure. We're going to do just 2 breaths. It's going to look like basic breaths today. Let's do like we did yesterday, where we spend the first 2 breaths kind of thinking about relaxing, right? That progressive relaxation. That's always a good thing to pair with our breathing. Remember, like we talked about, the more loose and open we can be during those contractions, the more work it's going to do, right? Okay, so we'll start with the cleansing breath, just a big sigh, and let's do our 10 long, slow breaths. Ready? Think about relaxing as you go. Halfway there. Last breath. Awesome. Hey, if you sat there and did those 10 breaths with me, I'm just going to give you a high five. That is amazing. It sometimes feels weird, okay? It can feel awkward. It can feel dumb. Anytime we're learning something for the first time, it doesn't feel normal. But by day 15 with me, this is going to feel so normal. I would love to say hello. Please say hello in a comment. I will reply to all the comments. It's nice to hear how you're doing, if you're practicing. Leave me your favorite emoji. That's my request for today. That would be great. And a like on the video always helps too. And thanks for joining me. Good job, you guys. Bye.